And Jane, I wonder if you could tell us, we've heard Catalyst in its resources and initiatives talk about positive cat-titude. And can you tell us kind of what that means exactly, what that looks like day to day in practice?
Well, yes, it's a mindset, and really, there's so many great resources out now for cats and cat practices, or people becoming cat friendly in their practices, that sometimes it gets overwhelming. And I really want to encourage people to even just think about one or two things that they could start with in their practice. And first of all, just kind of a reset for their mindset. And two word vocabulary swaps that I encourage practices to think about would be to think of the word handling and replace restraint, that R word, with the word feline handling. And how do we handle cats, and how do we know that they like to be minimally handled? So we have this adage called less is more, where we don't bear down on them and we just let them kind of be where they want to. So that would be the first mindset change: handling, feline handling. And the second one involves the using the word arousal. How do we as a practice minimize arousal of a cat patient that comes into our practice, and get away from that word aggression, cat aggression, this cat's aggressive? I can look back in early days of my practice and think about, oh, this cat is aggressive, 4 stars and a moon, and now we don't even use that word. So how can practices think about, well, what arouses a cat? And we know that fast movement or staring at them can cause them to be fearful or aroused. Well, what are some things that we can do to minimize arousal? And that could be a team effort to talk about how do we do that. And some examples would be, well, don't stare at them because they perceive that as a threat. And what I like to have people do is just look at them and look at the cat and slowly blink and make that a non-threatening way to examine the cat. Another way that would be minimizing arousal would be to just extend your finger to let the cat come to you, rather than reaching over to hold the cat or look at its mouth or anything like that. So that's just a couple of handling things that we can do to minimize arousal. And then the other thing about arousal is how to make your exam room, how to make your practice, what's an easy way, one initial thing you could do physically with your practice, and that would be to make a cat-friendly exam room. So thinking in terms of things that would minimize arousal would be to maybe keep that room very quiet, possibly dim the lights, having the exam table have something soft and warm on it. We started using those infant changing table pads that are oblong. They're about the size of an exam table, and they have a little lip on the edge. And we've all seen cats that get in, they want to be in the sink, or they want to get on the scale, and just that little edge. And we have found those to be wonderful in our practice. So it's just the little things to do to change your mindset about cats and becoming cat friendly in that way.
Thanks very much, Dr. Brunt.
My pleasure.